Well, this is the morning brief. Just before we go, let's quickly tell you that we are not done with you just said. That's because we have to cross over live now to the nation's capital, Abuja, as we get to talk about something really very important. It concerns you and it concerns us right here. It has to do with your health. Bukola.
Yes, indeed. Speaking of which, we now have joining us from our Abuja studio for this next critical conversation on neglected tropical diseases, Professor Joy Shu'aibu, the country director, Site Savers Nigeria. Professor Shu'aibu, thank you so much for coming on the program and for holding on for such a long time.
Thank you very much for having me. It's an absolute pleasure, and good morning.
Good morning. And so there are reports that, of course, Nigeria is making significant progress in the fight against NTDs. But sometimes some of us would assume that we know what NTDs are. Let's start with that, without an assumption. What are neglected tropical diseases?
Thank you very much. Neglected tropical diseases, as the name implies, are diseases that affect the poorest of the poor communities. We still find them in urban areas where you have poor sanitation and poverty. And the WHO has listed 21 diseases that fall under that category. Some of them, most of them can be prevented. Many of them can be treated. And there are some situations where it can actually reduce the quality of life of individuals, increase poverty in communities, and also lead to death in some cases. So they are neglected because they are a group of diseases that have not received the required attention from government and the society at large.
So reports say that 25% of Nigerians are predisposed to neglected tropical diseases. Tell us the factors that predispose, that encourage that level of vulnerability.
Thank you very much. Like you have mentioned, it's something that affects everyone. And that 25% of Nigerians translates to 1 out of 3 Nigerians having one form of neglected tropical disease. And the factors that contribute to this are poverty, because these people who are in rural areas do not have access to basic water, clean drinking water or sanitation. And this is where some of these diseases breed. We also have issues of access to healthcare, basic healthcare, primary healthcare. And so this allows for some of these diseases to continue to thrive and to affect communities where they exist. So hopefully, if the government is able to provide clean drinking water, and we are able to work collaboratively to ensure that the environment is clean and healthy, and people are educated on the effects of these illnesses and how they can be prevented or treated. Hopefully, we should have a better Nigeria, and Nigeria will certainly not be counted among the countries in Africa that bear the huge burden of neglected tropical diseases.
Prof, Professor Shu'aibu, just walk us through some of the prevalent diseases. Let's see if we can run through some of those diseases to remind ourselves of what exactly they sound like or look like.
Okay, so like I said, there are 21 of them, but currently as a country and WHO also. Okay, so the prevalence will vary depending on the areas where they are endemic.
All right.
And there are, for instance, like trachoma, which causes blindness, can be found mainly in the trachoma belt, which runs across the northwestern side of the country and the northeastern side of the country. We have pockets in the southeast, but mainly this is a disease that spans across the northwest and the northeast of Nigeria. And we have also what we call the river blindness. That one is associated with anywhere where you have bodies of water, so it's all over the country. And you have the soil-transmitted helminths, which usually affect mostly children and can lead to other debilitating illnesses that can get children out of school and affect their growth and development in total.
How would you describe healthcare facilities at that level, local governments level, community level, rural areas, how would you describe the state of our healthcare facilities at that level to handle some of these prevalence?
To be honest, it is far from what is desired, because most of the local government primary healthcare facilities do not have the basic amenities to be able to tackle these diseases. But more importantly, most of the medications that are required to prevent these diseases are not readily available in quantities that can be affordable to these communities. So even if the health workers have been trained and have the capacity to attend to these diseases, they do not have the required medicines to be able to do those. So there are issues of drug supply. There are issues also in some instances of availability of health workers, especially in recent times, where you have lots of health workers leaving the country. And then, of course, there are issues of knowledge and education of the health workers that work in these areas where these diseases are more prevalent.
All right.
What this tells me is that, you know, people have very few options, particularly those in rural areas where some of these NTDs are prevalent. But you know what they say in health, prevention is better than cure. So for those who are, you know, predisposed to the conditions that encourage, you know, sometimes the outbreak of some of these diseases, what are the options available for them in the area of preventive health?
You're right when you say that prevention is better than cure, and it's actually cheaper than cure, as we say in the health sector. And the options that are available would be social behavior change communication. And we want to thank channels for also taking the lead in this one. What we're doing currently is raising awareness about these diseases and empowering communities to help them understand some of the driving forces that live in their community that they can influence, not necessarily by paying any money, like building latrines and access to clean drinking water, ensuring that their environment is clean, because these are the things that will help reduce the spread of these diseases. We're also encouraging people and using the media in a way that they would understand how they need to also present to the hospitals early. Because if we encourage people to come to the hospital early, then some of the debilitating complications like blindness that can result from these diseases that continue to progress will be reduced. So we're using all forms of communication, sensitization to ensure that we prevent these diseases. But most importantly, like I had mentioned earlier, there are medications that can be used to actually prevent these diseases. But we also notice that if people are not very well educated, even when those medicines are provided, they will not readily accept those medicines. So communication and social behavior communication is something that is critical in preventing NTDs and also in treating those who come down with these diseases.
Mm. Professor Shu'aibu, because you've mentioned latrine, it just brought back some sort of memories for me. I'm trying not to mess the breakfast of people who are having one this morning, but I mean, some of us have seen better days. But there are still communities who have to use that form, you know. So I'm just wondering, is there something they can do? There are still communities where they still get their water from wells, some from streams that drink water directly from rivers, you know. So I'm just wondering, what's your advice? What's your word of, perhaps, what counsel would you offer such people? Because that's the option left for them.
Sadly so. You would think that the issue of access to basic things like latrine should be something that should not be mentioned in Nigeria, but there are many rural communities where they do not have any access to latrines or drinking water, like you have mentioned. And we know that things are hard for the government. And so my advice to such communities is to take their health and their lives in their hands. We have seen communities that have been activated and motivated within themselves to have like a joint community effort to build latrines in specific and strategic areas of the community. We've also tried to influence the community with many social behavior change communication messaging to say it's important, that you do this. So we've linked that to marriages and other things to help people become aware. So community efforts can go a long way. And of course, there's a limit to what the community and rural poor can do. And so the government needs to take also more responsibility in addressing these needs, especially for pure, clean drinking water for most of these rural communities. Because if we have that, it will really go a long way in reducing the prevalence of these neglected tropical diseases.
And now let's talk about the interventions that are being provided for those who are already suffering one form of NTD or the other. And I'm reading a report here which is quoting that 165 million Nigerians need preventive chemotherapy against NTDs. That's quite a number. Talk to us about cost of intervention for some of the leading NTDs that Nigerians are suffering, and what you see to be perhaps a lack or a measured political will of the healthcare institutions, to coming in to help sufferers.
So in terms of cost, we receive donations of billions of dollars of these medicines from directly the manufacturers from outside of this country to ensure that these medicines get to the people who require it at no cost at all. And but with this current funding landscape and the USAID cuts and other challenges that we face in the donor landing landscape, we see that that is not a very sustainable way of going at this. And truly, Nigeria has made a lot of progress in terms of elimination of several of the NTDs, because for decades, communities have received these medications, but there's still some way to go. And unfortunately, we haven't quite seen a lot of commitment from the government in terms of providing counterpart funding for these donations that come into the country. And so if the government doesn't throw their weight, I am afraid that most of the gains that have been recorded on account of the donations that we have been receiving to ensure that the people in the rural area get the required treatment that they need will not be, we will not be sustained. And we may, in the next decade or so, go back to where we started, which will be very, very unfortunate. Right. So we're hoping that the government will rise up to their responsibility for providing basic health care to the communities, especially in the rural areas, so that those who require these medicines can get these medicines when they need to get these medicines. And we will be far gone in terms of eliminating trachoma and other illnesses.
A fine place to anchor, and it reminds me of where we started the program, of the call on the Federal Ministry of Health to ensure that partnership to strengthen the primary healthcare centers at the grassroots level. We must thank you very much, Professor Joy Shu'aibu, the Director General, I believe, of Country Director of Sight Savers. Thank you for coming on the program.
Thank you very much for having me. And remember that today is World NTD Day. Please help us spread the word, because we want to unite, act, so that we can eliminate NTDs from Nigeria. Thank you very much.